As Bill mentioned, my name is Sjors Reijers. I'm the Manager for Program Promotions with Mental Health First Aid Canada. And I have to say right now, my head's spinning a bit with all this information about suicide prevention and all these excellent programs that are coming to the fore in an attempt to prevent and intervene effectively. And I think what we've been able to do here is drill down to a specific program, which is Mental Health First Aid Canada, that is well placed across the country, I think, to provide an intervention that can be useful to most people in most situations, I guess all Canadians. So I'm going to talk briefly about the Mental Health First Aid Canada program, and then talk a bit about our work in the workplace and adaptation that we're doing for First Nations people, and some of the evidence we have for the success of our course. So first and foremost, Mental Health First Aid is a tool. The first question I want to ask you before I go into the Mental Health First Aid, there you go, check it off.
For those of you on telephone, the question was, have you ever been certified in physical first aid? And so there are a ton, as you can guess, of folks checking off the yes, and some with no.
Thank you. So yeah, so you can see on that slide there, just before we get too far into it and into the next one, let's give a very quick overview of what Mental Health First Aid is for those who haven't heard of it before. So the short blurb we have is that mental health first aid is the help provided to a person developing a mental health problem or experiencing a mental health crisis. Just as physical first aid is administered to an injured person before medical treatment can be obtained, MHFA is given until appropriate treatment is found or until the crisis is resolved. So we draw direct parallels between mental health first aid and physical first aid. And that maybe 100 years ago, when physical first aid was first coming on board, there was a lot of requirement in the workplace and the community to have somebody there in case you slipped and broke your arm, or if you had a stroke or a diabetic seizure, somebody was available there to help you in the crisis until professional help was be identified. Now, 100 years later, we're at a point where perhaps physical injury or illness is not the primary concern for most people in their communities. As other presenters have already said, 30% of disability claims, 1 in 3 Canadians in their lifetime will experience mental health issues. So first aid now goes beyond the physical and includes mental health as well. So this first slide indicates to us that predominantly most of us have been certified in physical first aid at some point in our lives. Go to the next slide, please. So the next question is, the next slide should read, have you ever been certified in mental health first aid? So if you have or if you have not been certified in mental health first aid ever at any point in your life. And I love to see all those yes check marks. Look at that. So it's working. We're getting out there. So you see in this slide, so normally if I'm doing this presentation in front of a room, I'll get some yeses to mental health first aid, and a lot of no's, and a lot of yeses to physical, and then a lot of no's, but then I'll ask the question. So I'm standing in front of a room here, there's 150 of us. What's most likely to happen to me while I'm making this presentation? Am I going to break my arm, or am I going to have a panic attack? And so if I break my arm, then I've got lots of people rushing to help me, but if I'm going to have a panic attack, there's very few people that can have the skills to provide crisis first aid in that scenario. So mental health first aid is meant to provide that crisis first aid. So that's the question. So the next slide, please. Just a brief history for you about mental health first aid. We've trained so far over 60,000 Canadians. Came to Canada from Australia in 2006, so we started in Australia in 2001. First came to the Alberta Mental Health Board, and we came under the umbrella of the Mental Health Commission in 2010, which was the best thing that could have happened for mental health first aid because it allowed us to go into a national program. We have 700 instructors across the country, and we're currently offering 2 versions of the Mental Health First Aid course. There's a Mental Health First Aid Basic course, which is a 2-day course. And then the course Jenny mentioned in Nunavut that they're offering is the Mental Health First Aid for Adults Who Interact with Youth course. And that's 2.5 days or 14 hours in length. And it's a bit different, and I'll talk about those differences in a second. We are currently working on an adaptation for First Nations, and we're in discussions in early parts of other adaptations, including for seniors or peer-to-peer for youth. And the amazing thing about these 60,000 Canadians that have been trained is that we're looking at people from all sectors and all sections of society. From large companies that are getting people trained in their occupational health and safety committees, security guards at airports, correctional centers, construction workers, a lot of community organizations like CMHA has a lot of trained instructors that offer these courses in their communities. So we're really teachers, medical professionals. It's a wide swath of people that are taking this mental health first aid training, and we're very excited to see that happen. So let me tell you a bit about what our goals are as a program. Can you have the next slide, please? we have three key goals of mental health first aid, and these go back to what we were talking about earlier about prevention, intervention, and recovery being the key things for suicide prevention, and then as well to address those mental health issues that lead to 90% of suicides in Canada, or are contributing factors to those suicides. So the primary goals of our program are to increase awareness of mental health issues. So we look at the top 5 or 6 most common mental health issues in Canada, and we increase awareness of Canadians taking our courses. And by increasing that awareness, we're also reducing the stigma. And stigma is one of the biggest obstacles to mainstreaming mental health issues, like physical health issues are in our country. Nobody has to admit that they have cancer, but they have to admit they have a mental illness, the language matters. So we're reducing stigma, we're reducing discrimination, we're increasing awareness. One of the main things, of course, with preventing suicide and also with addressing any mental health issue is early detection of signs and symptoms. And I'll talk a bit more about that in the next slide, please. We want to be able to allow our participants to be able to detect signs and symptoms early, and also to be able to provide crisis first aid in a mental health crisis situation. So those are the key 2 things that we're trying to do, and through that, the hidden curriculum is the reduction in stigma. And I'll show you a bit about that in a few slides. But for now, it's early intervention, prevention, recovery, and providing comfort after the fact. So ensuring that our first aiders are able to carry on conversations, to start conversations that are difficult for a lot of us to have around mental health issues, to be able to say to a coworker, a friend, a neighbor, hey, I've noticed a change in your behavior. Is everything okay? And being able to recognize the signs and symptoms of depression or an anxiety disorder, or perhaps the onset of a psychotic disorder. These are the kinds of things that we are actually training Canadians in. Next slide, please. So how do we do it? What's the theme throughout the mental health first aid course? I don't want to give it all away, of course. I want you to come and take the full course because it's full of information. But ALGE is the acronym that we use, and you'll see it listed there. These are the 5 key things that mental health first aiders do when they're engaging in first aid, general mental health first aid for somebody that they suspect may be developing a mental health problem or assisting them through a mental health problem. And these are not a list of things that are done in order. These are a group of actions that can be done in any order, depending on how the conversation goes and how the first aid progresses. Next slide, please. Now, one of my colleagues, Denise, actually, she's our manager for program education. She often says she's been trained in CPR for 30 years and she's never had to use it. She said that she learned after she took the course the first time that she uses ALGE every day in so many situations that she never suspected that she was actually already doing mental health first aid, but she was. And a lot of our participants say the exact same thing. So what's actually in the course is on this slide. We do the signs and symptoms and raising awareness of substance-related mood, anxiety, and psychotic disorders for both courses. And then to the youth course, we also add deliberate self-injury and eating disorders to the course content, because those are predominantly for young people. And along with the early detection of signs and symptoms, there's the providing immediate assistance in a crisis. And these are the 5 areas where that first aid is taught. So suicidal behavior, overdoses, panic attacks, reaction to traumatic events for somebody who has acute stress disorder or post-traumatic stress disorder, and psychotic episodes. So for specific first aid for those instances, and then the ALGE model is used for each of those disorders that are listed there. So, including things like risk factors and people's family histories, other such things. And we can do a next slide, please. Let me make sure I get through all of this. So, Mental Health First Aid Canada, we're big on it. We think it works, and we have enough international evidence at this point to be able to point to the successes of this program. It's active in over 20 countries around the world. Somebody earlier mentioned Scotland's national strategy, and actually Mental Health First Aid is embedded within that strategy as a tool to use to promote awareness and reduce incidents and increase early intervention. So some of the key findings that we have with mental health first aid is the bottom 4 there. We have significantly greater recognition of the most common mental health disorders, which makes sense, and we talk about those. Decreased social distance is a big one for us. So as someone who has taken the course finds they're more likely to engage somebody they suspect of having a mental disorder than they were before. They're more confident in providing help, and then they've actually demonstrated an increase in the help. And one of the great side effects of the training is that the mental health first aiders themselves, they have an improvement in their own mental health because they're more aware of signs and symptoms and different things within themselves that they address it earlier and catch it more often. and these findings are consistent for 6 months after the course. And there's also lots more evidence on our website if everybody wants to look at it. So we've been invited on this call, and one of the great things that we're very happy about is a couple of months ago, mental health first aid was included as a best practice intervention by the Public Health Agency of Canada on the best practices portal, which means the evidence I just talked about held up under their scrutiny to say that we are indeed, the evidence does bear out that this is an effective intervention to improve mental health in Canada. So I encourage you to look at us up on the best practice intervention website. We're very excited about that. Next slide, please. And one of the main things we're working on now with mental health in the Mental Health Commission and also with Mental Health First Aid is mental health in the workplace. Some of this is already mentioned. John mentioned that 30% of all disability claims are due to mental health. We can say in 2011, lost productivity due to absenteeism and presenteeism. If you haven't heard that term, it means that you're present at work but not really productive, not fully productive. It's a $6 billion a year loss due to just that productivity loss. And the top point there is an important one for us, that only 25% of employees believe that their supervisor manages mental health issues effectively. So if our workforce doesn't feel comfortable telling somebody that they're experiencing a mental health issue or possibly an emerging mental health problem, then that needs to be addressed. And we feel like mental health first aid can be applied well in the workplace as part of an occupational health and safety committee or an overall psychological health and safety program within the workplace, and then can from there go into the communities as well as direct training within communities. So this mental health first aid in the workplace, it supports, next slide please. This supports the soon-to-be released national standard for psychological health and safety in the workplace. This national standard was championed by the Mental Health Commission of Canada, and Mental Health First Aid definitely is a tool that can support this standard. It's a voluntary standard, and it's being developed by the Canadian Standards Association and BNQ in Quebec, who will release it themselves as a standalone national standard. So it's meant to help prevent psychological harm in the workplace and promote psychological health in the workplace. And the standards, the rationale, those 5 points there are from an employer's perspective. What does it do for them to have a psychologically healthy and safe workplace? And we're doing a lot of work on that, and you can read more about that on the website as well. One of the key things to know about this standard is that it's not a dogmatic standard. It's very much it's a tools-based standard. There are 13 appendices to the standard, which is unprecedented international standard. The appendices are specific tools and strategies to use to implement in order to get a psychologically healthy and safe workplace. Next slide, please. The last thing I'll talk about before we go over to questions is our First Nations adaptation for mental health first aid. This is one that's currently in the pilot stage. It's being tested in different communities across the country, which I'll talk about in a second. But some reports were done. Before I get there, here's some of the stats, the sober stats on Aboriginals and suicide in Canada. These were already discussed by a couple of presenters, so I won't go there again. So next slide, please. So the Mental Health First Aid First Nations adaptation was designed and is being built based on research and feedback from our own participants and instructors, the Alberta Mental Health Board's Hansen Feasibility Report, Sykes Report, and a Health Canada evaluation in 2010. And all this feedback and research has suggested that mental health first aid is valuable to have in First Nations communities, but that culturally it needs to be redeveloped for cultural relevance and safety. Next slide, please. So the process by which the course development occurs is as important as its content. So there's 3 First Nations communities involved in the development of this and for piloting the project. They're at the bottom of this slide here is the Prince George Native Friendship Center, the Apaska-Wyak Cree Nation, and the Sioux Lookout First Nations Health Authority. As well as those communities, it's being collaboration with First Nations academics, guidance group, building upon existing mental health literacy and capacity in First Nations communities that choose to offer this course. Elders, community members, community leaders, First Nations mental health professionals. There's a large group of people that have come together to build a curriculum to ensure the cultural sensitivity and appropriateness. And one of the things to keep in mind with a First Nations course of any kind, of course, is that there are about 400 First Nations in Canada. There isn't one First Nation, so the intention of this course is to build a model that can be adapted to local realities and cultural contexts and historical contexts. Next slide, please. So I'll wrap it up here just in time to say that mental health first aid, one of the key things that's always important to remember is for all the the ability to recognize signs and symptoms, the confidence in providing first aid in a crisis situation, the ability to follow up and support someone's recovery from a mental health problem or crisis, is that mental health first aid does not train people to become counselors or therapists. It's repeated as often as the ALGE model is repeated in our course. We train people to be able to intervene as required, to start a conversation that might be difficult otherwise, to protect life and reduce harm. We're not able to diagnose individuals with mental health issues or emerging problems, and we're not able to provide ongoing counseling or therapy to individuals. And for most of our participants, this is a great relief to hear this, because some people will come into the course hesitant, thinking they might have to become a therapist or a counselor by taking this training, and we assure people absolutely that's not the case. A first aider, first and foremost, same as a physical first aider would never provide ongoing care for somebody with a heart condition. Mental health first aiders don't go ongoing care for somebody with a mental health issue. Next slide, please. And that's all I have to say. I'm looking forward to questions. Thank you very much.